to be seen by a fertility expert before embarking on your treatment journey. Bridget Sain, a resident of Nairobi, was diagnosed with cancer in 2016. A prolonged menstrual cycle coupled with agonizing pain were the hallmark of a disease that was slowly turning her cells against her own body.
At that time, I didn't know where I was ailing from. What I know, I used to have a lot of pain in my abdomen, especially during menses. And my menses could take long. It can even go for 2 weeks. And I had a backache, and I was feeling tired. Then I didn't know exactly, I didn't pinpoint what I was ailing from. So I decided to go for further tests. And when I went to the hospital, the doctor said that I had an ovarian cyst.
Like many, she was devastated after the first treatment failed. And as days went by, doctors could not nail a diagnosis of what was preying on her health. She felt like she had been failed by the very field of medicine she had banked her hopes on to help turn her health around. After a series of tests that left her feeling like a lab rat in the hands of doctors who strived to come up with a diagnosis, a stage 3 cancer of the urinary tract was zeroed into.
By then I was so devastated, I didn't know what I was ailing from. And when I spoke to the gynae, he told me that he's going to do a test, and that's why he did an MRI. And after doing the MRI, it's when it was discovered, actually I didn't even have a gynae issue. It was a urinary tract issue, and that's why they found that I had cancer of the urinary tract.
A cancer diagnosis that did not only bring with it 8 cycles of chemotherapy and 33 sessions of radiation, but also a toll that surpassed the treatment plan.
Ordinarily, it's a devastating news, and at first I was like in a denial, because I didn't know that. I have never even imagined that I will have cancer. So when they broke the news, there was a mixed reaction. One, I was happy because at long last they have gotten what I was ailing from. But on the other side, there was a denial, and I said no, it cannot be true. And I was with my sister. I tried to be brave at that moment, and I told the doctor that I will come back with a testimony. But after going back to the house, now the reality sank, and I knew that I'm going to die.
And just like any other patient diagnosed with a disease of such magnitude, her first reaction was to seek treatment.
At first they did surgery and they removed the mass. And after surgery now, I went to India now. When I went to India, they wanted to remove my reproductive organs, and I refused because they wanted to remove the bladder, the urethra, and the part of my womanhood, and I totally refused. And from there now they started the treatment. I started chemotherapy that went for 3 months. After chemotherapy now I started radiotherapy, and it took like 1.5 months.
Survival rates for cancer have increased over the years, and so is the desire of patients who are in remission to lead at least a normal life. Part of it entailing having children in the future, just like in Sain's case, who desires to have at least 3.
That was the most depressing news than even cancer itself. Because when I went to India, here in Kenya, they told me about the treatment plan that is going to be the removal of the urethra and part of my organs, and I refused, and that's why we went to India. And when we reached India, the story was still the same, because that is a standard way of treating that kind of cancer, because it was stage 3 cancer of the urethra that has spread to bladder and the part of my womanhood. And I refused completely, and I said no, I'm not going to allow my organs to be removed. And at some point, it's like we had a conflict with one of the doctor in India.
It is one thing to undergo cancer treatment and another to deal with the impact of the modes of treatment on one's crucial bit of life, fertility. For a very long time, experts say cancer care and fertility preservation were not a common conversation had on the same table. Gynecologist and fertility expert at ACES Health Services in Nairobi, Dr. George Ogweno, concurs that modalities of cancer treatment like surgery, use of chemotherapy, radiotherapy, and even targeted therapies have certain impact on fertility.
Now, there are a lot of things that affect fertility. Generally, we know apart from diseases, there is the age factor, which goes without saying. Looking at it, there are other many infections, especially in the sub-Saharan area. We have things like sexually transmitted infections that will lead to early problems that will lead to fertility. Now, the major thing that also leads to fertility but has highly been neglected over the recent time is cancer treatment. Yeah? Some cancer per se will affect fertility, but also the treatment has been shown. And that's why the term oncofertility was coined recently.
It's not just adults who can be affected by these forms of treatment. Fertility of prepubertal cancer patients can also be affected. Even so, multiple options, as explained by oncofertility specialists, exist that can help maximize a cancer patient or survivor's fertility.
Early enough, a lot of things could be done. There is what we call fertility preservation. Now, if you're looking at probably prepubertal girls or boys, you have things like gonads. If they're going to be affected, you can have tissue preservation, which used to be research, but now as early as a few months ago, it is a practice in the US, and I'm sure even here we can still do it. In other words, tissue preservation can be done for those ones who will require that. Now, if it is post-puberty, then for women, if you're looking at women, you could give stimulation with medication within a very short period so that you don't affect the cancer treatment. And then you can get those eggs, yeah, we call them gametes, and they can be preserved, okay? Yeah. Now, at that early stage, we know the best practice would be to keep embryo. Embryo is a combination of an egg and a sperm, but these are probably 18-year-olds or even a bit less. So issues of that might not be feasible.
Even though many cancer survivors are likely to maintain their reproductive potential after successfully undergoing treatment for the disease, others may experience permanent or temporary infertility as a result of their treatment or the disease itself. To help cancer survivors achieve their reproductive health goals, fertility experts recommend fertility preservation, a process that entails saving sperm, egg, or reproductive tissue for later use, in this case by a cancer patient, after completing treatment to enable them have children in future. With the advancement in technology, this can be done even after years of treatment.
If it's tissue, normally you need to get it through maybe laparoscopic. Yeah. Nowadays there's minimally invasive surgery, so you could go in with your laparoscope and take a small tissue. You can even take the whole ovary, or if you need to do that. That is being done. For here, we've not started doing that level, but tissue you can obtain through that. If it is maybe getting the eggs, then of course you do the same way we do with IVF in terms of removing them. So we still do stimulation, and we get the eggs through ultrasound and a small anesthesia through an ultrasound guided, and you're able to get your eggs. Okay, and if it's about you wanting to make a baby from them as early as that, then you fertilize and you can still preserve. In other words, you get sperm from somewhere else, either the husband, or you can even talk of sperm donors if that requires that.
In laboratories like this one, cancer survivors whose fertility is likely to get compromised during treatment get a second chance at life.
This is where the process takes place in terms of preparation. Both eggs and tissue were needed. So once you get it here, it is preheated to mimic the degrees of the body. So you are literally working like not too far from the body. Yeah, because once you bring out those eggs, they are very sensitive to a lot of changes in terms of heat, in terms of temperature, and even other things that could give them toxicity. So we work on them here, and there's a microscope. So once you put them here, you are able to see them on the microscope. So you are able to select. Yeah, once they come from there, you select the good ones. If they are eggs, you select from here. And then once you select them, you are able to want now to separate them. So we have several things you use. Then you do your fertilization. Once they've been prepared, then it contains a very dangerous liquid, which normally you need to keep. You can see how it comes out.
Just like in the initial stages of consultation for the treatment options available for any type of cancer one is diagnosed with, fertility experts recommend that all patients of reproductive age are sensitized on the risk of reproductive harm and fertility preservation. However, this is often not the case, as most patients would get to learn about fertility preservation after undergoing the treatment and not before as recommended.
Be your own advocate, because there are some of the things that doctors will never mention to you, especially when it comes to fertility. Not unless you are seeing an gyne-oncologist, but if you're not seeing a gyne-oncologist, some of these things, they don't matter to them. It's for you as a patient, you need to take initiative and ask us many questions about this treatment. How is it gonna affect your reproductive organ? How is it gonna affect your quality of life?
So what we do is that we have a procedure where we pull all the sperm cells that are in here.
Overall, sensitization not just to cancer patients of reproductive age, but also specialists in the oncology space on the importance of consulting a fertility expert before embarking on any cancer treatment will go a long way in giving cancer survivors and patients a chance to have children in the future. Gloria Milemo, KTN News.